Andrea Mosler presented on the sporting hip at the APA Level 3 sports course I went to back in February 2019, and it was really interesting because the hip's not an area that I've been particularly strong at, even though I really have an interest in shoulders and they're quite similar. I just never I never quite got the hip really well, but she made a lot of really interesting points. She suggested or stated that there's a really high recurrence rate for groin injuries, and that's because a lot of our rehab is impairment based rather than preventative and structured. She suggested also that a lot of hip issues are from cumulative chronic loads rather than spikes in loads, which, going through another talk that we had from Mick Drew on load management and a lot of Tim Gabbett's work and whatnot, spikes in load at the moment are the big in vogue thing, but particularly when it came to hip problems, Andreas was saying that the evidence suggests for this particular injury it's a big build-up or a slow big build-up of load over a long time. So something to keep in mind with the types of sports that your athletes might be doing. The hip is the leading cause of groin pain in athletes, and FAI, femoroacetabular impingement, is a big one, but you don't necessarily see it a lot in athletes because it usually stops them before they make a career out of being an athlete, compared to adductor problems and whatnot. Few sort of little diagnostic things. The C sign where someone's kind of holding their hip. That, along with the FADIR, flexion, adduction, internal rotation test. If someone's got those, then you can probably pretty strongly say there's something going on with their hip. A positive Faber test or even a positive FADIR test, a negative of those tests, you can strongly say that it's not the hip, but a positive won't necessarily mean it is the hip. But if you add in that positive C sign, then there's probably a fair chance that something's going on with their hip. As I said, they talked a lot about the chronic build-up of load, and it made me think a lot about GERD in throwers and whether some of these cam lesions develop as a response to loading in the same way that throwers lose their internal rotation over time, and particularly if you're a growing athlete and so your body grows in response to the load that you're putting it through. So it's very important to consider what younger athletes are going through. And probably the final thing to come out of that talk was around the Doha classification system, and they really strongly suggest it's a classification system, it's not diagnostic. So using those things to try and put people into categories to then be able to provide better management for them. So just a few interesting points to come out of that one.